we might otherwise. Again, for a big treatment effect on something that was very important, even if it was against a background of normal functioning, one could imagine scenarios in which a drug that had some significant risk might be appropriate. Anyway, it's just something for folks to think about. And I have one more slide, I think.
Yes.
Okay, so age-associated memory impairment, as it used to be called. Again, this has to. We've already heard about the various different definitions of normal versus pathologic. Certainly, by some definitions, this could affect many people. But again, here, the question of how safe would a drug have to be to improve memory impairment or to delay memory impairment in the aged, it's hard to know. And again, it might even be the case that how much safety information we would need would depend on whether or not people thought of this as normal or abnormal, although, as I say, in the law, there really isn't much of a distinction made between those two states. So in large part, whether something we're treating an abnormality or a normality or enhancing normal function is largely not a primary problem for the law. So Dr. Small asked, is it appropriate to develop a treatment for presbyopia? It's something that interferes with people's functioning. I would say the answer is, of course, it would be perfectly appropriate to do that. So I think I'll stop there.
Mm-hmm. Thank you, Dr. Katz. Very interesting. So it sounds like, in theory, developing these kinds of drugs would be entirely possible based on the